Today we are going to discuss about the Code of Ethics, and I am Akanksha from School of Nursing. So let's see what is Code of Ethics. So if we will see what is the meaning of ethics, so we can say that ethics are such rules or the principle which helps a person to protect their human rights. So what is the code of ethics? So code of ethics are the set of principles that are accepted by all the members of the profession, means those who are working in a specific profession, so, and those all people will follow the same code of ethics. So, what can be the purpose of code of ethics? So, one by one, we will see. The first is standards for the behavior of nurses and provide general guidelines for nursing action. So, we can say that key code of ethics provides or maintains such standards through which a nurse knows that how to behave in different situations and how she should uh, decide the action in different situation or condition during her practice. Another one is help to distinguish between right and wrong. So these code of ethics also helps or suggests the nurses how to decide the things whether they are right or wrong. So next is enables a correct decision, which helps obviously if they suggest or they helps to find out what is right and what is wrong, so that we can say that it also helps to decide or find out the correct decision for the nurses. Another one is it also helps to protect the right of individual. Either it is nurse, either it is person who is in need of nursing care. So for both, these conduct help the rights of the individual. Another one is it helps the student and the registered nurse to practice ethically. So these all are the purposes of code of ethics. Now next we will see what all are the code of ethics has been prescribed by International Council of Nurses, or we can say through ICN, what all are the code of ethics. So, in 1953, International Council of Nurses first adapted the Code of Ethics, and recently in 2012 they have revised this Code of Ethics. So, as per the ICN, first code of ethics is nurses and people. Nurses and people in the sense, so what all are the code of ethics for nurses as well as person, those who are requiring the nursing care. So here the nurse's primary professional responsibility is to people requiring nursing care. In providing care, the nurse promotes an environment in which human rights, values, custom, and spiritual beliefs of the individual, family, and community are respected. So here in this code of ethics, we must know, being nurse, that during our practices we should not disrespect anyone's belief, anyone's custom, means whatever our step is there in the providing nursing care, so we should remember that what can be their beliefs, what can be their rights of getting nursing care, as well as we should provide the nursing care with respect to the needy person. Another one is the nurse ensures that the individual required sufficient information on which to base nursing care are and related treatment, in the sense कि before providing the nursing care we should know what all things we should or we have to do, or what all nursing care we have provide. Another thing is we should explain all those things to the person, and we should also explain the thing that why that procedure or why that particular medicine or anything, why it is required for them. We should inform them, or else we can say that we should take the consent from the person before performing any procedure. Another one is if we are having any confidential information regarding any of the patient, then we should uh, maintain the privacy. We should not disclose all those information in front of the others. So these are the responsibilities. Another one is the nurse share with society the responsibility for initiating and supporting action to meet the health and social need of the public, in particular those of vulnerable population. So always this is our responsibility, that whatever is action required for the social need or for the vulnerable population, that we should provide all those nursing care with the responsibility and with the 100% of honesty. Another one is before before sharing any responsibility or anything, we should maintain such environment that the people, those who are in need of nursing care, they should get that nursing care with respect, and there should not be any kind of destruction or something which hurts the people. So here we have to see another one code of ethics is nurses and practice. Nurses and practice in the sense the nurse carries personal responsibility and accountability for nursing practice and for maintaining competence by continual learning. In any of the profession, we know that day by day improvement will occur, or as per the situation, as per the condition, things will change. So in the healthcare profession also, or in, or we can say in nursing profession also, day by day situation is different situation are arising, and different health issues are arising. So for that, a nurse should be competent to provide the nursing care to the people. And how it is possible? If nurse will be in continual learning process. So a nurse should update their self, through which she can provide updated nursing care to the needy person. Another one is the nurse maintain a standard of personal health such that the ability to provide care is not compromised. It means that nurse should maintain their health status. If a nurse is healthy, then only she can provide nursing care to the needy person or needy people. If nurse by her own self she is unhealthy, she is having pain, she is having fever, then how she can provide nursing care? That will be difficult for her. So nurse should maintain her personal health. Another one is nurse uses judgment regarding individual competence when accepting and delegation responsibilities. So nurse all alone she cannot perform each and everything, so she should be judgmental that what all things, whom she should she should provide, or what responsibility she should give to the to whom. So nurse should be having that decision making capacity, or nurse should be judgmental that okay, to do any procedure or any practice, she must know that what all things, how she should manage. Nurse at all time maintains standards of personal conduct which reflect well on the profession and enhance public confidence. So, all time, if a nurse maintain their standard, their working standard, then only people or person can be in confidence, then only a nurse can provide good nursing care. So always a nurse should remember that she should maintain the standards of the practice. Next one is nurse and profession. Next ethic, code of ethic is nurse and profession. So what it can be? The nurse assumes the major role in determining and implementing acceptable standard of clinical nursing practice, management, research, and education. Nurses active in developing a core of research-based professional knowledge. Another one is nurse acting through the professional organization participation in creating and maintaining safe equipment, social, economic working condition in the nursing profession. So here we should know that okay, fine, ठीक है. This is not only the thing that as earlier we were thinking that okay, nurse means she will go to the hospital and she will provide the nursing care to the needy person and she'll come back to home and that's it. No, a nurse and profession in the sense nurse is the only person who can identify day to day's challenges during nursing practice, and for that she should actively participate in the nursing researches and nursing education programs, so that then only she can maintain the standards of the clinical nursing. Another one is nurses and co-worker. Nurses and co-worker in the sense nurse sustain a cooperative relationship with co-workers in nursing and other field. Nurse take appropriate action to safeguard individual families and communities when their health is engaged by a co-worker or the other person or the another person. So we all know that nurse all alone cannot work for the community or for the healthcare needy people. So there are so many people or a group of person those who are providing health care to the needy person, healthcare needy person. So in that, nurse should work with the corporation or nurse should maintain the good IPR with the co-workers as well as with the patient, so that a nurse can take then only a nurse can take appropriate action to provide the nursing care to the needy person, healthcare needy person, and the family member or the community members. Next one is nurses and the society. So, what is the responsibility or what can be the conduct or what can be the rules for the nurses in this society when she is practicing? So, here we can see that participate and share responsibility with other citizen and other health professional, recognize and perform the duty of citizenship, aware of law and regulation, which helps in the practice of nursing and the medicine. So a nurse should know about her responsibility and nurse should know how to share the responsibility with the other citizens or healthcare professional. Then only a nurse can completely and devotedly provide the nursing healthcare to the society.